Alrighty, it's our favorite time of week. It really is because it's Thursday morning. We get to talk to Dr. B, and the weekend's close, and we learn some valuable information. According to the National Eye Institute, cataracts, glaucoma, and age-related macular degeneration are the most common eye diseases affecting Americans over the age of 40. Dr. Brent Wallis, Dr. B, joins us now from People's Health, the Chief Medical Officer of People's Health, to explain the different diseases, their causes, and how you can optimize your vision. Good morning, Doc. How are you?
Hey, I'm great, Tommy. How about you?
Well, I hope you had a great week, and I hope you're going to have a better weekend.
Yeah, I think I'm going to take Jack to the beach this weekend.
That's the Doc's boxer, in case you don't know. This means a lot to me, this topic, because I had an ocular occlusion, I think they call it, behind my eye, and I've been getting shots in my eye for about 10 years to try to save the vision. So I don't know if that's a common thing or not, but I know but for those injections, I would be blind in that eye. So it's a very important topic. I'm interested in talking about this. So I guess let's get started talking about some of the different diseases. The cataracts. What is a cataract and what causes it?
Yeah, so cataracts are clouding of the eye's lens, so what you see through. So what happens is you actually develop some blurry or fuzzy vision. And it can be in one eye or both eyes. And they usually start kind of slow, but then they'll grow slowly over time, starting to affect the vision. And really the most common cause is aging. As we get older, everybody usually develops some clouding of that lens, but it can be exacerbated or accelerated by things like injury to the eye, sun exposure. Smoking is another thing. And then really we do see it earlier and actually sometimes more progressive in diabetics as well.
What are some of the symptoms, I guess, of cataracts?
Usually what people describe as first is poor vision at night, so a lot of times when they're driving. And like I said, it can cause some cloudy or blurry vision. Some people can actually develop a sensitivity to light or even multiple vision, where they'll have double vision as well. And then people who are wearing glasses sometimes have to change their prescription multiple times as well.
Are they preventable, or is this something that eventually everybody has, if they're fortunate long enough, that they have waiting for them down the line?
Yeah, I mean, usually as you get older, you will develop some degree of cataract. Really, the key is how quickly it progresses, and if it starts to cause vision problems, then you have to get it taken care of. So, probably the best thing you can do to slow that progression is increase the amount of antioxidants in your diet. So antioxidants are found in green leafy vegetables, and so that can be very protective for your eyes for a lot of different types of diseases. But one of the other ones, too, that's important, especially here in Louisiana, is making sure you wear sunglasses and maybe a hat when you go out, because the UV rays from the sun can actually cause a lot of problems with cataracts as well. Definitely don't use tanning booths or sun lamps because that can accelerate it. And then, like I said, diabetics are more likely to get these earlier in life, so keeping your diabetes controlled is very important.
I had both eyes done last year, and I was able to work in the morning, get it done in the afternoon, and work the following morning, and it really is not that invasive of a procedure. And I guess it's come a long way in a short time, has it not, Doc? Cataract surgery?
Yeah, the surgery is pretty easy, and people are worried, someone's touching their eyes. But actually, it's a pretty simple procedure that's done in the office, and the recovery is real short as well.
Yeah, like I said, I was able to come back to work. One thing I can describe it as, have you had it or not, Doc, any cataract surgery?
No, I haven't.
It's kind of like you're seeing things, and then after the surgery, it's like somebody put your television on vivid. If that makes any sense to you, you see colors like you never really realized that they had before and like you were missing. So don't put it off. If you think you have any of those symptoms, certainly get it looked at. We're talking about glaucoma when we come back. Dr. B is our guest, Dr. Brent Wallis, Chief Medical Officer of People's Health, our senior health feature, and we're talking about optimizing your vision today. 8:20, time for traffic now on WWL. 824, Tommy Tucker, WWL, talking to Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, about senior health. But a lot of these things aren't just for you if you're a senior. It helps children, grown children of seniors, and even the kids themselves, because today we're talking about optimizing your vision. And Dr. B, that can affect people of all ages. And we move on to glaucoma now. What is that exactly?
Yeah, so glaucoma is actually a condition where there's an increased pressure in your eye, and that increased pressure actually can cause damage to the optic nerve. And when you damage the optic nerve, that can impair your vision, or even if it progresses, can lead to blindness as well. So most people are completely unaware that they have glaucoma. That's why it's so important to get checked regularly.
What are some of the symptoms?
Yeah, I mean, most of the time, like I said, you don't really know what's going on unless you get checked. But the first symptoms you can experience are a loss in vision. Blurry vision, similar to what we were talking about with the cataracts. But in particular, glaucoma can cause halos around lights. So when you're driving at night, you can actually see a little halo around other people's headlights. And then in particular, you can lose peripheral vision as well. So that's the vision where you can see things coming at you from the side. Usually glaucoma doesn't cause any pain. There is one type, though, that can cause some pretty severe pain. And if something like that happens, you need to see an eye doctor immediately or even go to the emergency room.
Is there a certain group that's at risk for glaucoma? How do you say that?
Yeah, I mean, again,
glaucoma.
Age is definitely a risk factor. So people over the age of 60 are more likely to develop glaucoma. And then there's a strong family history of glaucoma as well. So if your parents have had it, then you're more likely. And then again, unfortunately, diabetics can have higher incidence of glaucoma as well. The other groups that really need to take note and get screened regularly are African Americans and Mexican Americans because they tend to have a higher family history of glaucoma.
How do you prevent it, or can you prevent it?
Yeah, you can't necessarily prevent glaucoma itself. What you can hopefully prevent is the consequence of it. So you have to identify it early, and then there are medications that can actually work to lower that pressure in your eye and prevent the damage to the optic nerve and then progression. And again, if you have diabetes, making sure you have that under control can actually prevent the glaucoma from progressing.
And that brings us to age-related macular degeneration. When I'm in the office getting the eye shots, a lot of people there have age-related macular degeneration. What is it?
Yes, that's actually very common and becoming more common because we're living longer. Again, age is one of the risk factors for that. But age-related macular degeneration, or AMD, we call it, it's a disease that actually affects the macula of the retina. So the retina is the area in the back of your eye that allows you to have real clear vision or central vision. And we don't know exactly what causes it. Fortunately, we do have some treatments for it, but that can also result in a complete loss of vision or blindness.
And what are some of the symptoms?
So a lot of times, again, the symptoms don't appear, until you're a little bit too far in it. But a lot of people have trouble seeing real far. They have a lot of difficulty with color vision as well, and then especially when you're reading, they have difficulty with detailed vision.
Is that something you can prevent?
The best prevention really is identification. Again, it's knowing that it's there and then making sure you get treated for it. But again, diet can actually be very helpful as well. So antioxidants and then also fish in particular can actually help. The green leafy vegetables as well can prevent you from progressing to AMD as well.
So final word of advice for people wanting to optimize their vision?
Yeah, I think really the most important thing is to make sure you see your eye doctor. Most of these diseases are kind of creep up on you, and so they need to be identified early. So getting regular checkups is important. And unfortunately, our seniors with original Medicare don't have a vision benefit. It's not covered by the government. But most Medicare Advantage plans, like People's Health, actually do cover routine eye exams in your benefits. So if you've got, a family history and risk factors, or if you're having any problem with your vision at all, you should make sure you see a doctor and let them know about it.
Do not wait. Thank you, sir. I appreciate your time. Have a good weekend. Tell the dog hi.
All right. Thanks, Tommy. You too.
Dr. B from People's Health. You can find out more by going to peopleshealth.com. You can call 1-855-821-2666. Or you can follow People's Health on Facebook, Twitter, and Instagram. And I learned something just now because I played a lot of golf. in the sun with no hat, and that's probably why I had to get the cataract surgeries. We're going to take a break, come back, talk to Cynthia Lee Shang right now. Time for WWL First News, and for that we go to Dave Cohen.